and welcome to this very special program on StratNews Global. Whenever the people of our country have been in peril, the armed forces have never been far behind. We are right now in the middle of a crippling and devastating pandemic, the second wave of the COVID-19 pandemic, and all the three arms of the military forces, the Indian Army, the Indian Air Force, as well as the Indian Navy, are in the thick of action. Be it supplying trained medical staff, be it setting up of hospitals, be it in repairing defunct oxygen plants, be it in flying sorties carrying essential and critical supplies from all across the globe. The Indian military has its boots on the ground, as it were, and they are offering 24-hour services. To talk more about this, I'm privileged to have with me Lieutenant General Madhuri Kanitkar. She is the Deputy Chief of the Integrated Defence Staff Medical. And I also have Surgeon Rear Admiral C.S. Naidu. He is the Additional Director General Medical of the Indian Navy. I thank you both very much for joining us on this show. I would first go to you, General Kanitkar, and I would like to ask you if you could tell us a little more, give us a little more details on exactly what is happening as far as the military support to this pandemic is concerned.
Thank you, Nilanjana. And it is my pleasure to be here today to reassure the entire nation that the armed forces is here in its full strength to give maximum support. Our leadership has called out to the nation and to the armed forces to help in this time of crisis. So along with all the healthcare persons who have been termed as the healthcare warriors, we are both healthcare warriors as well as the warriors ready to serve the nation.
Let's get into a bit of the operational details, if I may. Could you tell us a little bit, say, about the availability and supply of drugs and of oxygen?
Definitely. I can sort of tell you about, we are carrying in our own hospitals. We have definitely availability of drugs and medicines, healthcare people. For oxygen, we are also dependent on the state authorities to fill up our cylinders and suppliers. However, because of the shortages that are come up, that we've started joining hands to procure our own oxygen generation plants, as well as looking up at other ways of beefing up oxygen supplies.
Just let me go across to Naidu. So, first of all, let me ask you, I believe that 98% of the military, especially the medical services of the military, have been vaccinated.
That's absolutely right. The medical personnel were vaccinated first as healthcare workers, and all military personnel were termed as frontline workers. And over 100% have been vaccinated for the first dose, and we're going to complete vaccination of the entire armed forces very soon. After that, we have taken up the vaccination of dependents, ex-servicemen, and we are also aiding the government in vaccinating civilians. As soon as the vaccines become available for the second phase, we will expand our activities.
You have the dual responsibility of operational preparedness, of course, at especially the front areas at the border, as well as providing round-the-clock service for COVID patients, not just for your own staff but also for the civilians. What are the other challenges that you're facing, ma'am?
The problem would be manpower restraints, and that's for two reasons. Because in our front line, the borders, where it's the northern front as well as the eastern front, these field hospitals are actually functioning on a day-to-day basis. They're not just there to be deployed. Because our troops are deployed, we don't have hospitals, large hospitals right up to, the borders in whether it's Leh, Ladakh or Kashmir and, Poonch, all those areas they are being looked after by these field hospitals at static locations, running, units which can move when required. So they're already operationally committed and committed heavily, as you all know. The second aspect is the ones which are sort of in the hinterland, with formations which are there at the hinterland. We have used that manpower to beef up our hospitals, as well as all the hospitals and civilians that we are looking after by the armed forces. Alongside with that, we are having to take a lot of initiative to handle and look after the welfare of our healthcare workers. So a lot of efforts are being taken for that as well, because we know how stressful it is to work. It is not a war that they fought for, a week, 10 days as we are used. Here is a war which is going on for the last 14 months. It was first one episode of COVID, after which the healthcare workers didn't get a respite because there was so much backlog because of the lockdowns. The people came back to the hospitals. So we continued all the cold surgeries and the workload came on in full force. And even before we could really stabilize on that, came in this bout. So it was like a double whammy or triple whammy, and we are handling all that. So it's very important to handle that effectively, efficiently, and yet caringly.
Let me come to you, Admiral Naidu. And first of all, if you could tell us, as ma'am was saying, about how you have thought of revamping or getting the manpower together to address this particular crisis that we're dealing with.
As General Kanitkar has said, this war has been fought for a long time, literally since March of last year. We had a short break when we thought we were doing well, and then the second wave has started. And the healthcare workers have been at the front line. And what one must understand is that normal life carries on too. You're getting cases coming for deliveries, you're getting appendicitis, you're getting trauma, road traffic accidents, that is, though it is a lot less because of the lockdowns. So it's very important to have staff who can cater for all these basic and necessary needs of a hospital. So we have divided our assets into fixed assets, those who cannot be moved, and the rest as those who can be deployed. And even these deployable assets, we have divided into two halves, so that a healthcare worker who's fighting COVID doesn't get exposed for more than 2 to 3 weeks before he or she is turned around. So that is the way we've been pulling in people. Second, as you know, COVID, there is a variance in the country as far as the incidence in certain states vis-a-vis other states. So since we have medical formations in states which are not so affected, we are able to pull out more people from there and mix and match, so that at any given time we are able to help the government wherever the healthcare personnel are required. During the first phase, we realized that the healthcare workers get taxed even in mundane other administrative activities in a hospital. Someone to man the helplines, clear the oxygen cylinders, help with the handling the next of kin, so many other activities which any other person can do. And then within the hospital itself, there are small things like taking a temperature, helping a patient with his bed sheets, helping in the catering of the food, just helping a person walk to the washroom. Those kind of activities can be taken on by anyone, but it takes a little bit of training. So what we did was, all our young sailors and officers from the other branches, including technical branches, were given capsule courses over a week in which they were taught everything about patient care, how to measure the vital parameters of a patient, how to wear, doff a PPE, how to wear a mask, how is the handling in a COVID zone to be done, how to take precautions. So this way, the level of their medical knowledge went up, and we have termed them as BFNAs, Battlefield Nursing Assistants. And as the second wave started, we've had a refresher course for them, and they are now being deployed to help our healthcare workers in the hospitals.
Not just people who have survived COVID, but people who have lost their near and dear ones. There's a lot of grief, a lot of suffering everywhere. So what are you doing, and what have you thought of in terms of the mental health? Because that is one aspect that is not really addressed very easily, especially in India. What are you doing regarding the mental health of people?
Yes, I think you touched the thing extremely well, that there are two groups. One is reaching out to the people who are actually losing their people day in, every day we do see. And I think treating that with utmost sincerity, utmost compassion is required. And actually, we do need professional counseling and a bereavement service, which is very streamlined, and we are trying to do it in our armed forces hospitals. But I think this is where NGOs, and this cannot be left to only the medical professionals. And I think even in the civil hospitals, I think we need NGOs. And there are a lot of, while you see the pyres burning and you feel so bad about it, we also hear so many wonderful stories of humanity and kindness, where people unknown are coming forward and helping such. I think it's important to showcase those and discuss those, because that brings in hope. And, let's everyone get over despair and think positively. I think we have to look at those aspects. In our own hospitals, yes, we try to, have these services streamlined. And initially, we did not have so many cases, so we were handling it all alone. But this name Kojit came in because we've really jumped in it as a huge, not just Jeet over COVID, but a huge cooperative group. So you see, today Sudeep and me are sitting looking as if we are the same. Otherwise, I'd be in green, he'd be in white, the Air Force wouldn't bleed blue. But we're all wearing one. We're all just having the single thought of to do best. And in that, we are being supported very strongly and by our leadership from the arms, whether it's Army, Navy, Air Force, all of them. And we are getting support of these officers to take over, whether it's communication. I mean, patients don't have problems or any complaints against doctors. It is these ancillary services. And I think in that communication, when a patient, gets admitted, firstly, he would like to know whether there's a bed available. Second communication is when a relative gets admitted, everyone is so scared, so worried. They need to be in touch. And I think they need to be in touch and be informed, as well as the patient have an opportunity to connect with his near and dear ones, because that is what gives him the enthusiasm when he's in a ward of sick patients, himself anguished, breathing, high liters of oxygen. He needs a kind word. He needs that, caring words from his relatives. So I think this is a very important aspect which we need to address. And the second part that you said for our healthcare workers, having realized that we are creating two services which are there. One is we're calling it this. We have our telemedicine service called Sehat for the armed forces and the veterans. Especially for the healthcare workers, we've created a group of it called Sehat Sathi. And this Sehat Sathi is being run by our veteran psychiatrists, who are trained people who, and our healthcare workers have been given the opportunity from the, their own rooms, their own place of where they are kept in quarantine, because they're working with COVID. They're almost in a bubble whole day. From there, they can reach out and talk to these people. So that's one aspect. And besides that, we're also launching another called Sehat Sahayata. In Sehat Sahayata, we are specially reaching out to young women and girls who have additional problems, because there's no time to, normal workplace, you have various, for women workers, our nursing officers, our young lady officers, they probably feel even more there are gender difficulties. So to understand those, our senior officers' wives and some of our senior lady of serving doctors who are not on active COVID duty, they would be the other end, available as a line to just chat up with a younger sister. So these are two schemes we've launched. Besides, every service headquarter has brought out its own SOPs, the Air Force, the Navy, the Army. We have the helplines, but these are more one-on-one. So while we are ruling this war and marching on with our head, we are also leading it with our heart.
Yes, that's so good to know, ma'am, and that gives a lot of hope and optimism in these very bleak
Yes.
times. Let me end by let me ask the last question to you both. I will first start with Admiral Naidu. Let's talk of prognosis. How do you see the pandemic? How do you see the response to the pandemic overall? Not just military, but overall response playing out over the next 3, 6, and the next 12 months. Because there have also been reports of a third wave coming in, which is likely to infect children much faster. So, what do you have to say to that, sir?
See, in the beginning, when COVID first started, I can be frank and say that none of us knew where it was heading. We didn't know what India's status was. And if you see purely statistically, I think with the government leading, we did a fairly good job in the first wave, as far as in comparison to any other advanced country goes. There was a lot of public involvement, knowledge, and there was a very good response. The second wave, of course, has come as a bit of a shock. But what it has taught us, we are going to get over that. I'm sure we're going to win this. And what it has taught us is that we are ready now with capacity building in case of a third wave. Also, the vaccination is taking off. A large number of people are now completely enthused. Initially, there was a little vaccine resistance, I would say, but that's over now. You see people lining up for vaccination. And once the vaccination is complete, I'm sure that we'll be able to battle the third wave on a much better footing.
General Kanitkar, if I may just ask you, the India has rejected the United Nations offer of an integrated supply chain of essential COVID-19 materials. What are the merits or demerits of that decision?
I don't think I'm in a position to really, because these are decisions which are taken with a lot of brainstorming by a lot of senior agencies which are looking at all the geopolitical issues related to this. But what I do see is a very, very positive thing that we have become Atmanirbhar. And it makes me so proud that whereas we started off this without no one, I think today even the child's vocabulary has a pp and a sanitizer and everything, and there's availability in plenty. This wave, though it really came as a tsunami, we haven't need to look up to anywhere for our basic ppes or sanitizers. Yes, the only problem has been oxygen and a little bit of this thing of medications, because we didn't expect it to be so huge. I think we've learned a lot of lessons how to handle this COVID situation. And the virus caught us a little when our guards were down, because after the first wave passed away and things started coming under control, we started enjoying and meeting. That's a human nature. So I think this has taught us that with coronavirus, you can't let your guards down. So we would need to ensure and stress on continued use of masks, your hand sanitizing, keeping distances, not getting together in large numbers, especially indoors in crowded places. So these are aspects which we'll have to take care of. But more important than that, what is the armor? I mean, you're called the military, and the only armor we have is immunity. So two things that can be done is ramp up vaccination, ensure everyone is. Look at the success that Sudeep told you. Most of us, since almost 99% of our troops are vaccinated, we've not had a single death in a serving soldier who's fully vaccinated. So this is what we'll have to ramp up. And we'll have to do sero surveys to see that our antibody levels are maintaining. Because the virus mutating and the antibodies levels going down, it comes and hits you like it was all starting once again. So this is the second lesson. Third is a continued lookout on mutations and the genetic variations, and what are the variations which are of interest, which have to be followed up. And finally, I think we need to have a capacity building. If you had enough beds, enough oxygen,
you are not worried. I mean, if you have the whole division there and there was a platoon coming, we'd attack it. But problem is because you have a platoon and this little RNA virus has come like one big, huge army at us. So therefore, I think ramp up and create our resources is the final. I think this is something. And my last message would be, let's look out and care for our children, because the vaccine has not been given to children below 18 years. But hopefully the studies would come in. And once we finish with that, we'll start ramping up and improving their vaccination. But having said that, we'll also start preparing and keep our pediatric wards, our pediatric intensive care units, all of them prepared. They would anyway be a national resource. So I think these are some of the steps. I'd like to end on a very positive note, because together we will win.
Thank you very much, both of you, for giving us time and for talking to us. And I do hope that this message, ma'am, that you have sent out regarding immunity, regarding staying safe, regarding being mindful of what havoc this virus can create, I think that is really important. And also taking care of one's mental health, another very important aspect that you talked about, both of you. Thank you very much for joining us on this show. I request all my viewers to please send us your feedback, to please follow us on our social media platforms, and subscribe. And also, I look forward to seeing you again on our YouTube channel very soon. Thank you very much.